After living in denial for close to 4 years, Moses Nsubuga, commonly known as Supercharger, decided to start on treatment in 1998.
I've been living with HIV for the last 25 years. I decided to become open after 2001 to educate others.
Supercharger, who is now an activist traversing the country to educate people on HIV and AIDS, says dealing with new infections, especially among young people, is the major challenge today.
Supercharger uses such events like this local boxing bout to talk about HIV and AIDS, but he says emphasis now should be put on following up people who have been identified to have HIV and AIDS.
I want to bring people on board. I want people to get the knowledge. I want those who test positive like me to start treatment, because the treatment we have can take somebody for 90 years.
In 2018, about 1.4 million people were living with HIV, and an estimated 23,000 Ugandans died of AIDS-related illnesses. As of 2018, the estimated HIV prevalence among adults aged 15 to 49 stood at 5.7. Women are disproportionately affected, with 8.8% of adult women living with HIV compared to 4.3% of men. Other groups particularly affected by HIV in Uganda are sex workers, young girls and adolescent women, men who have sex with men, people who inject drugs, and people from Uganda's transient fishing communities.
What does the government of Uganda has to do? They have to create what they call an adherence intervention program. Adherence means taking the medications correctly, feeding yourself correctly. The government, what is the government doing about it? Nothing. All they do is put you on treatment, give you medication.
The Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, says they are yet to carry out an evaluation and review of the 1990 strategy.
Usually we wait till the end of every year. At the end of the calendar year is when we pull the program results together and we do the analysis of, new infections, people who have tested, those who are on treatment.
Uganda has 13% of people on treatment not suppressed. And when you are not suppressed, means you'll infect your partner. When you are not suppressed, it means you'll have a positive baby. So when you are asking yourself, why do we have new infection? That is answer number one. You are having new infection because Supercharger or Robert, they are not suppressed and they are sleeping around.
Dr. Musoba says the population is now more aware of HIV and AIDS.
That we think, when you go out there and speak to people about HIV, there is more information that has gone out than, before. Not just the president being part of this initiative, he was also able to give us additional guidance, including guidance on communication, accurate messaging. We got recordings from him that, were launched a month ago, that we are on the verge of rollout.
He believes that with the current performance, the country will meet the global target, which has a 2020 deadline.
By the end of June 2019, we were really close to, 99, I think for the first 90 people who had tested to know their HIV status, we were at 86%. For those who knew their HIV status and were on treatment, we had surpassed the target, and then for viral suppression, we were at 89. So we are pretty confident that we are going to meet the 99 targets.
However, the country still grapples with a huge burden of new infections. The 2018 UNAIDS report placed the figures at 53,000 that year. This means the country registers over 150 new infections per day. Dr. Musoba is optimistic about the future, especially with the addition of funding from government.
The Minister of Finance provided additional funding specifically for ARVs. They provided 50% additional money, I think, up to the tune of $13 million to go towards the funding for antiretroviral therapy. So a number of successes around messaging, around financing, and we'd like that to continue going into the new year. We'll still need funding from our partners because we are not yet in a stage where we can win off, but we want either that to come to 50-50, but not to be predominantly donor driven.
Walter Mwesije, NTV.